Institutionalization is a pattern of passive dependent behavior observed among psychiatric inpatients, which is characterized by hospital attachment and resistance to discharge. So, in simple terms, this is just a situation where the patient says no to discharge, which can be due to multiple reasons. Causes or contributing factors to institutionalization: lack of guardian and family. Due to this, the patient prefers to stay in the hospital where they feel protected. Lack of material and resources. When these people become institutionalized, they fear to go back home because they don't have capital to establish a living. Abandonment by family and guardians. The family and friends tend to reject the patient due to his condition, which might be violent. Domestic violence. This is because where the patient comes from, they are physically abused, hence the patient is put chains, is being denied food, and they are beaten. Substance abuse of parents or guardians. This is because after parents abuse substances, they cause harm to the victim, hence they refuse to go back home. This can also be explained as an effect of child abuse, for example. Extremely poverty. Under this point, the victim knows where he or she comes from, there is poverty, so prefer to be institutionalized. Other causes of institutionalization: stigma and discrimination, conducive work environment to achieve therapeutic goal, loss of contact with the outside world, lack of independence and responsibility in hospital, living with unsupportive family and home environment. Signs and symptoms of institutionalization: apathy, which is lack of interest in issues affecting one's life. Here the patient may appear indifferent or unconcerned with no response to stimuli or display of emotion. Lack of initiative. The patient lacks the ability to begin a process or activity on their own without the aid of a staff. Total submissiveness. The patient tends to follow whatever he or she asks to do without questioning or reasoning whether it is good or bad for them. Lack of individuality. Here the patient fails to do things alone. They lack self-reliance and independence in their day-to-day activities, which later leads to learned helplessness behavior. Passive dependence on staff. Here the patient depends on everything which the staff plan for him or her. Low self-esteem. They lack confidence in their own abilities or worthiness. Feeling of helplessness. Definitely any person may lack feeling of hope if they are found in a depressing or an environment in which their humanity is denied through being beaten, teased, or passing of negative comments. Well, what are some of the measures to prevent or cure institutionalization? Fighting stigma and discrimination. This is important because if the patients feel accepted in the community, they would likely spend less time in the hospital as they will have a feeling of belonging to a community. Fighting stigma is through community sensitization about the negative aspects of stigma and its effects. Encouraging family support. Adequate support from the family will encourage short hospital stay as care can be continued from the home setup after the patient recovers. Family support will also enable the patients to be in contact with the outside world during their stay in the hospital. Promote clients' individuality or independence to carry out tasks with minimal supervision. The client should be responsible to handle some of their basic needs. Ensuring clients have short stays in the hospital, and this can be by linking them to the community mental health and other available social support services. The shorter the duration of stay, the lesser the chances of a client being institutionalized. Individual and family psychotherapy.